Today's online session, we'll be having an overview of basic concepts in MLT1. The topic of today's online session is overview of basic concepts in MLT1. All right. So, students, in your first semester, there is a subject BVMLT 102, which is attributed to whose name is Basic Concepts in MLT1. So, we'll be taking this subject today. We'll be talking about the whole syllabus of this subject. We'll take an overview. We'll take an summary, a gist of all the contents which are there in this subject. All right. So in today's session, we'll be talking about all the units of the basic concepts in MLT1. That what it is about, or what all content it has, and we will have a brief overview, brief outline about these contents in today's session. So we will be focusing on all the units separately, all right, in today's session, students. So the basic concepts in MLT1 revolves around the concepts, the technology, the things which are there in the medical laboratory technology. All right. So in today's session, we'll be having an overview about the basic concepts, the technology that we are using in the medical laboratory technology. All right, students, this is clear to you. So let's start today's session. So the syllabus of this subject, basic concepts in MLT1, includes 4 units. As you can see on your screen also, there are 4 units, and the 4 units are: in first unit, it is attributed to basic principles and procedure of laboratory. As you can see on your screen, the first unit is about the basic principles and procedures of the clinical laboratory. What it means now? It means that the basic principle and procedures which are used in the laboratory will be having an introduction about that. All right, we will be having an introduction to the concept of healthy living, that how a person can live healthy, how we can stop the spread of infection while working in the laboratory, what are the laboratory hazards we are at risk of, that are possibly we can get into if we will not be having the proper practices, proper hygiene to curb or to reduce these infections. All right. So next we'll be talking about in this unit measuring and dispensing liquid. So we'll be talking about how the different containers that are used for measuring and dispensing liquids in the laboratory, and which techniques we should use while measuring and dispensing the liquids in the laboratory. Thereafter, there are safety precautions with glass and plastic containers, which one to choose, glass or plastic one, in which type of sample or which type of reagent. So basically you will get an idea about the equipments and the instruments that are used in the laboratory, as well as you will get an idea about the concept of healthy living and the techniques that are used, the principle on which we will work in the laboratory. All right, so first unit is about the basic principle and procedures that are used while working in the laboratory. Now the second unit, this unit 2, is about care and maintenance of the glassware. So while working in the laboratory, you will come across many instruments and glasswares to perform different tests and to perform different tasks. So for that, you need different glasswares and instruments as well. So if you are using the glasswares and instruments, you must know how to take the care and maintenance of these glasswares and instruments, so that their shelf life can be increased, as well as you can limit the finances. You can limit the finances of the lab also. All right. The care and maintenance of glasswares, it includes the cleaning methods that are used for cleaning the glasswares, the types of different laboratory equipments which are used in the laboratory, and their principle, that on which principle which instrument work, what is the use of different glasswares, and the this instruments. All right. We will be reading about the instruments such as balance, Bunsen burner, funnel, pipette, bulb, autoclave, centrifuge, laminar airflow, hot air oven, incubator, water bath, cell counter, and the microscope. So we'll be having an overview and introduction about these instruments, that what are these instruments and why these instruments are used in the laboratory, what is the purpose of using these instruments in the laboratory, and how we can take the care and maintenance of these glasswares and instruments while working in the laboratory, so that we can increase the shelf life of these instruments and glasswares. Third unit, next unit is about introduction to the different laboratory reagents. When you are working in a laboratory, there are different reagents and chemicals that are used in the laboratory. So in this unit, you will get an introduction about all these laboratory reagents that we commonly use in the laboratory, all the care and maintenance of these laboratory reagents, and how we should use them, how what are the precautions that we have to take while working with different laboratory reagents. For example, if you're working in a laboratory, there are different type of acids also, they can be corrosive also, some of the chemicals are flammable also. The different reagents fall into different categories in which they are. All right. So the different categories of the reagent must be treated with different care and maintenance. So we'll be reading about the different categories of the reagents that are used in the laboratory, so that we can know that how should we deal with the different types of chemicals and reagents. For example, hydrochloric acid is also there, which is highly corrosive. It can corrode your hands if it will drop on your hands also. To deal with all these chemicals and reagents, and what all precautions you need to follow, comes under unit 3. Then next unit is unit 4. Unit 4 is about infection control and prevention. So we'll be talking about what is infection, how we can control the spread of infection, because understand this thing, that when you're working in a laboratory, you're at high risk of getting the infection as well as spreading the infection into the environment, because you're dealing with the samples of the patients, of the healthy persons. You don't know which person is having which kind of infection. First of all, we have to deal each patient sample as highly infectious one, because we never know which sample is highly infectious and which is not. So we must always deal with each of the sample as highly infectious one. All right. In this unit, we will be talking about what all practices we need to curb the infection, to reduce the infection in the hospital, in the lab area, and as well as the environment. Then we'll be talking about the hospital borne infection, that what is hospital borne infection, and how we can stop the spread of the hospital borne infection, what all prevention and treatment we can take for the hospital borne infection. Next is the treatment of needle stick injury. We are at high risk of getting the needle stick injury, because what all we do, we have to take the samples, we have to we have different sharp instruments that are used, that may be dipped into the samples. So we are at high risk of getting the needle stick injury while working in the laboratory. So we should know what treatment we have to take if in case a needle stick injury has occurred to someone or us itself. All right. So next we'll be talking about the spillage of the blood and bodily fluids that is there in the laboratory. If in case some of the spillage of blood or any type of body fluid occurs in the laboratory, we should know that how we should deal with this spillage. All right, so overall the syllabus of basic concepts of medical laboratory technology revolves around what medical laboratory technology is, what are medical laboratory technologists, what are their roles and responsibilities, how we should deal in the laboratory, what are the work ethics that we should have while working in the laboratory. It is an introduction to the instruments and the glasswares that are used in the laboratory, and how we can take the care and maintenance of that, and how we should stop the spread of infection from the laboratory to the outer environment. So I can say that the basic concepts of MLT 1 is all about the introduction to the medical laboratory technology and the medical laboratory technologist. All right, students, this is clear to you. Moving on to the next section. All right, so I'll be taking all your queries and doubts at the end of this session. At the end of this session, I'll be asking for you for your doubts and queries. So you can note down your queries and doubts, what all doubts and queries you have throughout the session, and you will ask all the queries and doubts to me at the end of this session. All right, students. So I'll not be taking the queries in between because it will hamper the class flow. So we'll be taking the queries at the end of the session. All right. Now, what is medical laboratory technology? So, medical laboratory technology is a basic course which equips the student with the most essential knowledge and skills pertaining to the medical laboratories. All right. So, we can say that it is a basic course. All right. It is a course in which the technologists perform complex tests and procedures which help other healthcare professionals, such as physicians, doctors, and others, to detect, diagnose, and treat diseases. All right. So we can say they often collect samples of body fluids, tissues, and other substances from patients, test and analyze them, and discuss their findings with the physicians. All right. So this is what a medical laboratory technology is. It is about dealing with the laboratory services, dealing with the test, performing the test and taking the samples, and discussing and interpreting the results of the tests that are being performed on a patient. So in this course there is importance of laboratory services, role of medical laboratory technologists, you have to know about it, use of laboratory wares, instruments, and sterilization techniques you should know, the prevention and control of laboratory accidents, and institution of quality control system. So these all are the most important pillars of the medical laboratory technology. All right. Now, what is a laboratory? First of all, you should know what is a laboratory. Then only you will understand what is medical laboratory technology and what all function, what all things you perform. So, laboratory is a facility. We can say it is a facility which provides controlled condition in which the scientific or technological research, experiments, and measurement may be performed. So we can say it is a facility which has the controlled condition, the optimum conditions which are needed for the test to be performed, which are needed for the researches to be performed, and different tests are performed, different measurements are done, and we come to an we come to an conclusion, we come to an interpretation. Now, what is a medical laboratory or clinical laboratory? So it is a laboratory where tests are done, tests are performed on the clinical specimens in order to get information about the health of the patient. All right. So a medical laboratory is a lab where the tests are performed in under the optimum condition, but on which samples? on the clinical specimens that are collected from the human beings, the bodily fluids that we collect, and we give the diagnosis of the disease, we due to which the physician or doctor can come to an treatment and prevention of the disease. All right, now what is medical laboratory science? So it is the use of clinical laboratory to test, to detect, diagnose, monitor, and treat diseases. All right, so medical laboratory technology is the science, is the branch of science which deals with the study of the clinical laboratory test to detect, diagnose, and monitor the diseases that can occur in any human being. So for that, what we collect, what a medical laboratory technologists collect, they collect the sample of blood, tissue fluids, and body fluids that can be chemically or physically or microscopically examined for presence of any kind of abnormality in them. All right, the information that we get from these tests is then used by the or by all the medical team to make decision that which kind of treatment must be given, which kind of prevention must be given to the patient. So all right, so around 85% of all the medical decisions are based on the results of the clinical laboratory testing only. All right, students, this is clear to you that what is medical. Now, what are lab tests? These are the medical procedures which involves testing sample of blood, urine, or other tissues or substances in the body. All right, so these are the what does the medical laboratory technologists work? So they work in the lab and usually spend most of their time on their feet. They're required to wear the mask, gloves, goggles, and other protective equipments while they work. All right, so they often collect the samples of body fluids, tissues, and other substances from patients, test and analyze them, and discuss their finding with the physician itself. All right, they are also called as the medical laboratory scientists, clinical laboratory technologists, and the clinical laboratory scientists. All right, students, they also use different procedures for reaching the interpretation of the clinical sample on which they have performed the test. Now, why does your doctor use lab test? So the doctor uses the lab test to identify the changes in the health condition before any symptom occur. Number two, to diagnose a disease or condition even before you have symptoms, or you are having system, or your or your condition or your health condition is not, we are not able to reach. If the doctor is not able to reach, it also gives certain tests to check if or if all the possibilities of the infection and disease. Plan or for the treatment of disease or condition, the laboratory tests are required to evaluate the response of treatment, that how the prognosis is going on. The doctor may use a lab test, and to monitor the course of disease over the time, the lab tests are used in the laboratory. So many factors can affect your test result, which can include your sex, your age, what you eat and drink, the medicines you take, and how well you follow the pre-test instructions. So a medical laboratory technician who is collecting the sample, who is performing the test, must be always clear about all of the medical history that a patient has, as well as he or she must be aware about the pre-test instructions that are required for each of the tests that he is or she is performing. All right, so this is clear to you. Now, talking about the basic principles of the medical laboratory technology, what all basic principles are used. So what are basic principles? So basic principles are basically the things, the values on which a medical laboratory technologist or a medical laboratory technician relies and must have to follow all these rules, regulations, regulations, the basic ethics to work in the laboratory. All right. So the clinical, what all basic principles are there? Let's understand this. So the clinical and principal workers are equally at risk of acquiring transmission diseases through the patient through the test samples. So as I told you, that the medical laboratory technician or technologist are at high risk of getting the infection. So why they are at high risk of getting infection? Because we are continuously dealing with the samples, the bodily fluids of the persons, and we never know which one is highly infectious, which person's blood can be having the HIV infection, which person's blood can be HCV infection. You are not able to tell this with the blood sample only. All right. So we are at risk of acquiring transmission diseases. So we must also always follow the basic principles, rules, and regulations, the ethics that are made by the World Health Organization and other organizations as well, which are working towards this need. All right. So first of all, what is the basic principle? Disinfect the working benches and as far as possible, uh, autoclave various glassware used in the laboratory. So number one basic principle is the disinfection. So while working in the laboratory, this must be your regime, for the daily routine. This must be included in your daily routine, that you have to perform the disinfection. How disinfection can be performed? That you have to perform the disinfection at the start of the day, while you enter, as soon as you enter into the lab, the first thing that you have to do is the disinfection. All right. So at the start of the day, while starting the work, disinfection must be performed, and at the end of the day, while leaving the laboratory, disinfection must be performed. So disinfection can be done with the help of different chemicals, different like physical things. So there are different techniques which are used in the laboratory for disinfecting. Your working slab on which you have worked must be always wiped with the 70% alcohol to disinfect it, so that there are no infection. You can remove, or you can stop the spread of infection. As well as your glasswares that you are using in the laboratory, you must autoclave all the glasswares and the instruments that can be autoclave. So autoclave is an instrument which uses the technique of moist heat sterilization. So you must keep all the equipments that can be like sterilized in the autoclave for autoclaving it. All right. For disinfecting it. So number two is to develop an understanding of the concept of healthy living. So all medical laboratory technologists must develop an understanding of the concept of healthy living, that how healthy living can impact, how healthy living gives the positive impact on our lives. Because if we are not healthy, we will not be able to stop the infection. You should never enter into the laboratory without eating anything. All right. So like on empty stomach, you should not enter the laboratory. You should always have your breakfast prior to entering the laboratory for work. All right. Place the well-being and service of the sick above your own interests. All right. So this should be the moral responsibility of each healthcare, whosoever is a healthcare person who is providing services to the patient. They must always keep the services and the well-being of the patients above their own interest, because uh, we are working for a noble cause. All right. We this is the thing, that we are working for financially for it. We are getting paid for the services that we are providing, but we should always bear in mind that we are a healthcare worker. If you are a healthcare worker, we have also taken the oaths to place the well-being and sick well-being and services of the sick above our own interest. Now, next is be loyal to your medical laboratory profession by maintaining high standards of work and strive to improve your professional knowledge. All right, we must always strive to improve our professional knowledge, because what is medical laboratory science? It is the science, it is the science which is like which is getting changed day by day, which is getting updated day by day. So we should always be updated about the different diseases that are coming, the different things, the different technologies that is coming, that how we can improve ourselves and improve the results that we are giving to the patient. All right, so we should be always loyal to the medical professional. We should not be giving the false results for just for the sake of our interest, or just for the sake of our comfortability. So we should never be compromising with the results or with the testing of the patients. All right, so next is work scientifically and with complete honesty. So you have to work scientifically. Do not measure your professional skills or knowledge for professional or for personal gain. So you should never measure your knowledge or professional skills for any personal gain. Never take anything from your place of work that does not belong to you. It comes under the ethics that you should never take anything from the place that of work which is not yours, which is of your organization. Do not disclose to a patient or any unauthorized person that result of your investigations. So whatever investigations are like they are not to be disclosed, they are secret. You should never reveal these kind of investigation to any unauthorized person or any patient or any attendant also. You just have to give the reports to the person who has taken the test, who you or the attendant of the patient. You just don't need to give the telephonic conversation to the patients or attendants. All right, so you have to treat with utmost confidentiality and personal information that you may have learned about the patient. You should always respect and work in harmony with other members of the team. You should be courteous, patient, and considerate to the sick. You should promote healthcare and prevention and control of the disease. Now, talking about the procedures in the laboratory, the procedures of the laboratory. So, the laboratory should be designed in such a way so that there is enough space for free movement of the people working in it. So, this must be the point, that the laboratory in which you are working, the laboratory that you are designing, must be always spacious, and there should be enough space for the free movement, because if there would be not enough space, then there would be chances of spillage of the fluids or the chemicals or the reagents which you are working with. If if it will spill, there are high chances of spreading the infection. Next, a cramped laboratory is likely to lead to the accidents, damaging the equipments and endangering the life of individuals who are working in such an environment. So it should be adequately ventilated with strong currents of air. It should have ample of lighting arrangement, because some of the measurements relies on the color or the viewing it physically. So there should be proper lighting in the laboratory. So in the work benches that are used should prepare ply be 12 by 2 feet high, and those to use while standing should be at least 3 feet high. Now, what is the role of medical or clinical laboratory science in healthcare? So, it plays a vital role in the promotion, curative, and preventive aspects of a nation's health delivery system. The services given gives a scientific foundation by providing accurate information to those with responsibility for to monitor the development and spread of the infectious and dangerous pathogens. It is used to decide the health priorities. It is used. All right, now why the laboratory is needed in the healthcare. So the laboratory is needed in the healthcare for, first of all, for providing the quality, effectiveness, cost effectiveness, and planning and management of the district healthcare system. As well as it is also important for the treatment, diagnosis, and detection of the disease, because without the laboratory, without performing the test, diagnostic test in the laboratory, no one can lead to the confirmatory decision that a person is suffering from this disease or not. You never know before performing this. Maybe the symptoms are there, but the symptoms sometimes can be like clubbed with different diseases. There can be different disease also. So to reach to the detection and the interpretation of the diseases, there must be also diagnostic test performed. All right. Next. So next is types of laboratory. This is very important for you people, that how many types of laboratory are there. So in many countries there are two types of laboratories that that you can see, or that you may have also seen. First one is the hospital laboratory, and the second one is the private laboratory. So talking about the first one, so hospital laboratory are those labs which are attached to hospital, which are there in the hospital only, and they are taking samples from the IPD patients also, who are already admitted to their wards or different departments, as well as it is taking the samples of the OPD patients who are coming to the hospital for the treatment. All right. So hospital laboratories are there, which are those laboratories which are there in the hospital itself and performing different tests on the patient. Now number two is the private or community laboratory. So private or community laboratory are the ones which are owned by some private or personal. For example, I am a medical laboratory technician, and I want to I have the license to open the laboratory, and I have opened my own laboratory in some of the community or some of the society, whatsoever you think. For example, there are SRL labs, there are Dr. Lal Path labs. So these are the community labs which are there in the community and which have their own community. They have their own franchisee. People can open the labs. They can receive the samples from the general physicians, the insurance companies, the different companies. The persons can come by themselves only to get tested for different tests. So these are the private laboratory. So a lot of samples are sent between different labs for uncommon tests. It is more cost effective if a particular laboratory specializes in a rare test. All right. So in now talking about the different departments of the laboratory, what all different departments are there. So basically the departments of the laboratory can be, first of all, it can be clinical pathology, in which in which we are dealing with the different body fluids such as urine and stool of the patient. Then there is hematology laboratory, which deals with the and testing of the blood samples and testing the blood related disorders, such as we test the CBC comes under the hematology, it's the complete blood cell count. The PBS, the peripheral blood smear, is performed in the hematology laboratory. Then there is a clinical microbiology. So microbiology, in clinical microbiology there are different departments, sub departments, such as bacteriology, in which we study about the bacteria. We cultivate the bacteria, we get to know about the bacteria, we identify the bacteria using different biochemical tests. Then there is virology, in which viruses are cultured and then they are tested. Then mycology, in which we study about the fungus. Then the parasitology, in which we study about the parasites, the parasitic infection that can be there in the person. There is the immunology and serology, which are depend upon the antigen and antibody reaction, which can be there in the human body, in the such as the tests such as HCV, HIV, the beta HCG are performed in the immunology and serology laboratory. Then there is clinical biochemistry laboratory, in which we perform the biochemical assays, the chemical reactions that are undergoing in the human body, that we study under the biochem in the clinical biochemistry laboratory. It also deals with the hormonal assays of the body. All right, next is the blood bank. So blood bank is a separate body, but sometimes it is there with the laboratory as well, because blood bank deals with this collection and storage of the blood components that has to be transfused to the different persons. All right, so these were some of the different departments of the laboratory. One more department is there, which is histopathology and cytopathology department. So histopathology department deals with the study of tissues and the organs. So in histopathology laboratory, we receive different types of tissue samples and the organ samples. We cut them and then we study them. In the cytology laboratory, we get different aspirates from the body, such as we can say the CSF we get, the pulmonary fluid we get, the abdominal fluid we get. So we study about all of these aspirates in the cytology department. Now, what are the professional code of conduct and the ethics that we use in the laboratory? They are not something very different, as I told you in the basic principles and processes that you have to follow. That these all are the professional conducts or the ethics of the laboratory. All right. So laboratory policies, what are laboratory policies? These are the decisions which are taken in consultation with other medical staff to enable a laboratory to operate reliably and effectively in harmony with other. So these policy may cover laboratory hour and emergency work, the collection of laboratory specimen. That the laboratory policies, we can say, are the policies or the things that are conducted in the laboratory for all the people or the persons who are working in the laboratory. It is basically a code of conduct. The SOPs are made, the standard operating procedures are there in the laboratory that you have to follow. Each laboratory has its own different standard operating procedures, but these are determined by the World Health Organization itself. All right. Now, the structure of medical or clinical laboratory services. So, a laboratory service network consists of, first of all, community-based primary healthcare laboratories there. These are the primary healthcare laboratory that can be either private or run with the help or with the aid of the government also. Next is the district hospital laboratory. So the laboratory which are there in the district hospital are called as the district hospital. And then next is the regional hospital. So there are regional hospital. The laboratory in those regional hospital are the regional hospital. Then the central and public health laboratory is also there, which perform different tests. So this was about the unit 1. Now talking about the different laboratory equipments that we use in the laboratory. So there are different laboratory equipment, as you can see in this picture. Also different type of equipments and glasswares are shown to you that are used to perform different tests and the procedures in the laboratory. So the different laboratory equipments that we use are it can be beaker, it can be funnel, it can be pipette, it can be a microscope, it can be a funnel, it can be a conical flask, it can be something, it can be Bunsen burner, it can be autoclave, centrifuge, incubator. So these all are the equipments and the instruments that are used in the laboratory. First of all, beaker. So beaker is a simple container. It is a cylindrical container which is closed at the bottom but open at the top, and it is used for stirring, mixing, or heating liquids, which are commonly used in the laboratory. So they are basically cylindrical in shape with a flat bottom. So this let me show you if this thing is the beaker. It is cylindrical. It is flat. It has a flat base at the bottom, and it is open from the top. It can have a lip for pouring the liquids. Next is test tubes. So test tubes can be sample tubes or the culture tubes that are used in the laboratory. They can be they are also cylindrical, but they are narrow than the cylinder. All right, than the beaker. All right, they have a U-shaped bottom usually. Some cuvettes, which are also used as test tubes, are flat at the bottom, but otherwise other test tubes are have a U shape at the bottom. They are commonly used for like collecting the sample, for like performing different tests in the laboratory also. All right. So test tube can be plastic test tube or glass test tube, depending upon the test that we have to perform. Next is the Florence flask. So this kind of instrument is called as the Florence flask. As you can see, it has a round body at the bottom with a single long neck, with either round or a flat bottom. So it can have a round bottom and also a flat bottom. So these kind of containers are called as the Florence flask. They are designed for uniform heating, for providing the uniform heating and ease of swirling. If you have to make we have to prepare any reagent or for any kind of solution to for performing the test, then we have to we can take the Florence flask, because it provides uniform heating and swirling is easier in these type of container. Next is the triple beam balance. So different types of balance are also used in the laboratory for measuring the amount of the solution or powder that is used in the laboratory. So depending upon the amount that has to be measured, different type of balances are used. The one that you are seeing in this picture is the triple beam balance. It is used to measure mass very precisely. It has a reading error of around only plus point minus 0.00 0.05 grams. All right, so it has three beams, where the middle beam is the largest, the far beam of medium size, and the front beam of the smallest size. So it is used to measure the powders, the reagents that are there in the laboratory very precisely. Next one is the pipette. So pipettes are the most commonly used tool in the laboratory. They are used to transport a measured volume of liquid. They are used to dispense the media, dispense the chemicals, and as well as measure the amount of liquid that has to be taken for the test. So these are very precise and very accurately we can measure the amounts from them. The one you are seeing at the upper portion is the normal pipette, which has a rubber bulb attached to it. It is also known as the pasture pipette. And the second one is the micro pipette, which is common and essential liquids. They are available in single channel and multi channel. If we have to transfer the sample more accurately and precisely, we use the micro pipette. Some of the pipettes come, they are already fixed. You cannot change their the volume of the liquid that you have to transfer or dispense. But some of these micro pipettes come with an average range, which you can set. For example, it can be from 10 to 100 microliters, so you can fix the amount that you need to dispense from these micro pipette. Now talking about the infection control and prevention. So infection control and prevention is a practical, which is evidence-based approach which prevents patients and healthcare workers from getting in any kind of infection, and as a result of antimicrobial resistance. So infection control and prevention, we can say it is an approach which is used in the laboratories and hospital to prevent the spread of infection. So infection, it can occur. What is infection? Infection is a clinical condition which can occur when when a human body or any other body comes into the contact of foreign pathogenic antigen, and these foreign pathogenic antigens start causing harm to our body by producing different types of antigens or either the different mechanism. All right, so the infectious pathogen can be anything such as a germ, bacteria, virus, fungus, protozoa, parasite. So whenever we get the infection from these whenever we come into contact with these kind of pathogenic organism, our body comes into the state of infection. So infection control and prevention is an approach which is followed by the hospital and laboratories to reduce the infection. So the chain of infection is central to your understanding that how infection spreads in the workplace. So there is infectious agent, susceptible host is there, and then infectious agents come, then it spreads to different people. So it comes into the reservoir with the portal of entry from the oral route, from the fecal route, or any of the route it comes into the contact of the patient. Then different modes of transmission are there, either by water, by air, or by any other means. And then again it comes into the portal of entry of other person, then he becomes the susceptible host, and then the infectious agent is again released into the environment. So this is how the chain of infection goes on and on and on. So some of the standard precautions are used to in the hospital and laboratory to stop the spread of infection in the environment. All right. So these all are adhered as a matter of etiquette and work health and safety, regardless of whether you or others in the workplace appear to be infection. So first of all, hand hygiene has to be always maintained while working in the laboratory. So it refers to washing your hands with antibacterial soap or and water, or and use of alcohol to get your hands disinfected. So it consists of around 7 or 9 steps of hand washing. So you have to use these hand hygiene in the laboratory or hospital while working, while dealing with any patient, before dealing with any patient, and after dealing with any patient, before eating the food, before preparing the food, after using the toilet, and after coughing or sneezing into a tissue. So you must always always refer, you must always perform hand hygiene before and after dealing with the patient. You should always cover your mouth and now nose with a tissue, or you can get help with the upper sleeve of your with your upper sleeves also. Always put your use tissue in the waste basket. All right, so these are some of the etiquettes that you have to develop and use while working in the laboratory and hospital for stopping the spread of the infection. Now cleaning and disinfection are also used. Hot seats or shared equipments must always be decontaminated with the alcohol swipes, and the areas which have in which the food is served, the waiting area is there. So these area must always be cleaned routinely, and more specifically because these areas are the areas from where this infection can be spread easily. All right. Now, next one is the disposal of waste, because disposal of waste can pose a very harmful impact on the environment by spreading the infection. So we must always know how to dispose of the hospital waste or the laboratory waste that is there in the that is generated in the hospital or laboratory. All right, all right. So it can be very dirty and many of the germs can be present. So there are different containers that are used in the laboratory, different categories of the container is there. So we must always dispose of our waste in the different categories of the waste containers that has been designed for the laboratory. For example, the general waste, it is always if I talk about the laboratory, the general waste is discarded in the black container. Then there is blue container. In blue container, what we dispose of? We dispose of like infectious glasswares that we use in the laboratory. Then in yellow container, human anatomical waste is discarded. Then there is transparent container in which the sharps has to be discarded. So different types of categories of the containers are there. So in different categories of the containers, we must dispose different type of waste that has been classified and categorized, because different types of waste has to be treated before disposing it off into the environment, so that we can stop the spread of infection. All right. So, say for the safe handling of needles and sharp disease, you can see the puncture proof and leak proof container is used. Generally transparent container is now used for the sharp containers, for disposing of the sharps. All right. Now, what is hospital borne infection? So, hospital borne infection, it is also called as hospital acquired infection or the nosocomial infection. So what it is the infection which is developed, which you have not developed before entering into the before entering into the hospital, but after into entering into the hospital, the other kind of infection that you acquire from the hospital itself is called as the hospital acquired infection or the hospital borne infection or the nosocomial infection. It can be during a hospital visit or while admission into the hospital. So there are different hospital borne infection, different types of you can see it can be from the urinary catheters. You can get the urinary tract infections. In case of surgical procedures, you can get the surgical site infection. In case of central venous catheters, bloodstream infections can be there. In case of mechanical ventilation, a person may have pneumonia. So what are the prevention? Frequent hand hygiene must be performed. Proper use of PPE should be there. Appropriate antimicrobial should be given to the patient. Routine disinfection should be performed in the environment in which the patients are there. Indwelling devices such as urinary catheters, when they are not treated, they must be removed ASAP, as soon as possible, to lower the risk of hospital acquired infection. So how can spillage be prevented? So we must always store the chemicals in the covered areas. Spill kits, bunts, and spill pallets should always be there in the laboratory or a hospital. The store containers should be in the secure shelving. Overcrowding should not be there. The chemical should be kept below the eye level, and we should always regularly inspect chemical containers on site for leaks for deterioration. So this is how you will stop the spread of infection. So this is all about today's session, students.